Begin.
Hello, good morning, examiner. My name is Noor, GMC number 8084919. May I proceed?
Yeah.
Hello, good morning. I'm Noor, one of the junior doctors at the GP today. May you confirm your name and age for me, please?
Um, I'm Alex Parker and I'm 26 years old.
Good morning, Alex. Nice to meet you. So I can see from my notes that there is a different name. So could you please explain this for me?
Uh, well, actually, uh, I'm trans. Okay. Um,
Okay.
I was assigned as a female, but now I'm male.
Okay, I'll be sure to change this information in our further consultations. I'm sorry for the misunderstanding.
Okay, no worries.
Is there something you'd like to talk about today?
Uh, well, doctor, yes. I got a letter of having cervical smear.
Oh,
Um,
yeah, okay.
Yeah, I'm just asking, am I eligible to have cervical screening?
Well, do you mind if I ask you a few questions before we proceed?
Um, okay.
Okay, so I just want to know if you have started any transitioning, medical medications or surgical interventions.
Well, I'm on testosterone
All right.
and voice therapy as well.
Okay.
Yeah.
And have you done any surgical procedures or?
No, no.
Okay. So since you've not done any surgical procedures, this means that you still have your cervix, part of your female genitalia, and so that makes you eligible for the cervical smear test, and it is sent routinely as a screening test for all females registered in our system.
Okay. Even
It's
if
an
I'm
invitation
taking,
letter.
yeah, yeah. Okay. So what is that pap smear, doctor?
Okay, so you've never done it before?
No, I didn't do anything like this before.
Okay, so it's basically a procedure where we take a swab from your cervix and we send it out for testing under a microscope. And it's just a screening test for cervical cancer, early screening or early detection.
All right. Okay. And okay, is it painful, doctor?
Well, it shouldn't be painful. However, since you're taking this testosterone, we do take extra precautions to make it as comfortable as possible for you.
Mm-hmm.
And that's if you wish to proceed with it. I would just like to make sure you understand that it's completely your choice whether or not you proceed with it.
Okay, so I so is it mandatory to do this or to have this
Not at
test?
all. It's completely your choice. It's the letter you were sent was an invitation letter. And if you would like to proceed with it, I'm more than happy to explain everything.
Okay, all right. Um, okay. Yeah, but what how to know that there's cancer, or you told me that it's a prevention for cancer. So how do you know that this test show cancer or not?
Okay, so by taking a swab from your cervix, we use a brush. So this brush is then sent to be examined under a microscope for us to examine the cells and see if there's any change in the nature of the cells or to detect any early pathology
Mm-hmm.
or any early um, signs of any change.
Okay, all right. Okay, and
Okay.
what are the risks of having cancer? I mean,
Okay, so there are general risks and there are individual risks. Being sexually active being sexually active poses us to contracting something called human papillomavirus. And this virus is considered to be one of the leading risks for developing cervical cancer.
okay, all right. But if I'm not sexually active, I'm not sexually active to be honest. So
Okay, so I
Risk.
understand. Yes, there is, as I mentioned, there is an individual risk and a general risk. It's not that every single person who was diagnosed with cervical carcinoma was actively sexual or had human papilloma virus. So that's just an individual risk.
Okay. All right. Okay, doctor.
So, do you mind if I ask you just a few more questions?
Okay.
Do you have any medical conditions?
No.
Okay. And do you have any family history of cervical cancers?
Not that I'm aware of.
Okay. And you mentioned to me that you are not sexually active.
Yeah.
Okay. And regarding you generally, how's your mood?
Oh, my mood is okay.
Okay. And do you
2
feel
minutes remaining.
supported?
Sorry?
Do you feel supported throughout your
Um,
journey? Do you need anything from our end?
well, no, to be honest, everything was is going smoothly. I'm taking the medication and going to the post therapy, and um, we are planning to have a surgery in 1 year. So yeah, everything is
Okay.
going smooth.
That's wonderful to hear. That's good to hear.
Yeah.
So you mentioned to me that you were planning to have the surgery soon. So, do you mind telling me what surgery it is?
A correction
Okay.
down below. Yeah.
Okay. So, if you're going through with this correction down below, as I mentioned, you still do have a choice on whether or not to proceed with the cervical smear. The cervical screening. So, if you're going to do the surgery and remove the cervix, then there's no need to attend any of the upcoming screening tests.
Hmm. Okay.
That's not something for you to worry about.
All right. Okay. Yeah.
Okay. And do you have any other questions regarding the cervical screening? Is there anything you'd like me to explain?
No, no, doctor. I think I'm going, to make myself. I don't want to
Okay,
have
that's
this
completely
problem.
normal. That's
Yeah.
completely normal. And I'm just going to provide you with some leaflets regarding it. And if you change your mind at any point, we're more than happy to proceed with it at your request.
Okay.
Um, do you agree to this so far?
Yeah. Yeah.
Okay, that's wonderful to hear.
Thank you.
I hope you complete your journey.
Yeah. Thank you. Thank you.
See you.
All right. Thank you. Okay. All right. Thank you, Doctor Noor. How do you
Well,
feel?
doctor, I don't know. It was quite I don't know if I started the session wrong because you were so down in the beginning. So I guess
Move on
that's
to the
because of
next
how I
station.
started.
Okay. What else?
I don't know. Counseling sessions are the worst, doctor.
Okay. Well, to be honest, you've covered everything. Okay.
Okay.
In terms of data gathering, you gathered the correct data. Okay. Apart from one thing, which is I I can say it's irrelevant. Okay.
Okay.
I'm going to tell you what is it. All right. You answered my questions. You were supportive, to be honest, but the start was a little bit awkward.
Yeah, I noticed.
I mean, okay, it's written in the question that she's trans man and assigned as a female. So you told me I can see that there is a difference between the names. So can you explain this to me? I felt that I'm
Oh
being
yeah, yeah,
accused about
yeah,
something. Okay.
yeah.
So if it's written in the question, Mrs. Blah blah blah, her name now is blah 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 blah, and it's clearly said that this is trans.
Mhm.
Okay, so no need to ask this question. I
Okay,
mean,
then how would I start it? Like,
what would you like me to call you? Everything is written. So birth name is Mrs. Helen Parker. Okay, blah
mhm,
blah blah. She's transgender man, assigned
correct, yeah.
female at birth,
Mhm,
transitioned to male. Okay, so
mhm.
everything is written. No need to ask this question with this context, with this. I mean, the question that you asked with this prompt, with this
Yeah.
question. um, it is awkward and it's a kind of accusation to the patient.
Yeah.
Okay.
So do I
Yeah.
start it by saying, how would you like me to call you from the beginning? Like, good morning, how would you
Yeah.
like me to call you?
Hello, my name is Noor. How are you doing? Well, okay. What would you like me to call you?
Okay. Okay. Thank you, doctor.
Yeah, that's it. All right. And if he tells you I've received a letter, okay,
Mm,
and then you can show him that I am a caring doctor and I've written the notes and I know that he's transgender, right? I can see that that you're concerned about this. Is this because maybe you are under transition, maybe, right? That's why
hmm
you are just confused about this thing. Yeah.
hmm
So this is
Yeah.
how, to be natural
Yeah.
with
Okay.
with the situation. Okay. Um, if they tell you patient name is Helen Parker,
Mm,
okay, and they didn't give you anything about transition, about being trans man, about anything, even they didn't tell you the current name is blah 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 blah, then at this stage you can ask this question.
okay.
Got me?
Yeah. Yeah. Yeah.
In this way, the situation is vague. Then you are asking because I'm a bit confused. So the name is here and your name is here. Got me?
Yeah. Yeah. I guess
Okay.
that would have been better. Yeah.
So it depends on the situation. I'm happy that you've done this mistake. All right.
Yeah.
This helps everyone here to manage the situation properly based on the information that they have. If we don't
Mhm.
have this mistake, maybe someone here just do what you does what you do in the
Mhm.
future. Okay, so yes, it's good that you've done this mistake. Okay. This is the first thing. Secondly, you've just turned the station upside down.
Yeah, I wanted to because you started with the concerns.
You
So
counsel me. Okay, which is okay. No, it's fine as long as you've done everything and
yeah.
the station was logic. Okay, but if I were you, I'm going to ask my questions first. All right, to be able to
Mm.
answer the questions, appropriately. Yeah.
Okay.
You
Yeah.
answered me, okay, but it's better to ask about, has he done any tests before, any family history of cancer as well. You asked sexually active. You didn't ask me about sexual activity, and
You
I
said
prompted you
no.
and asked you what are the risks, okay, just to prompt you that you missed asking me few questions, okay.
Yeah.
Um, the mood. This is the irrelevant one.
Because
Uh,
they're
why
transitioning,
did you
so I
ask me
thought,
about the mood?
can you hear me, doctor? Sorry.
Sorry. Uh, yeah, you can tell
My
me.
internet
Yeah.
was a bit laggy. So I asked about the mood because
Yeah.
I thought that they're transitioning, so it would be like to show support, to show like if they need anything. Because it was going very
Well, the other
awkwardly,
questions,
so I tried to
yeah,
pick it up.
the other questions were better. Yeah, the other questions you asked me, do you feel supported um, in the transition? It was better than asking about mood. You can ask about mood if you see that the patient is showing you non-verbal clues,
Yeah.
down, looking anxious, looking frustrated, and at this stage
Yeah.
you can ask about mood. Um, all right, so you can pass this station. To be honest, you covered everything. In terms of the history taking, in terms of counseling, yes, they might give you a tick in the consultation because you
Mhm.
were not, you've turned everything around, okay, but which it's understandable in counseling, but usually try your
Yeah.
best to start by taking the history first to have a good ground to explain things to the patient better, okay.
Okay.
um, Mood is irrelevant. This is the only one which is irrelevant in history taking in addition to the start, okay.
Yeah.
Your
Yeah.
answers were really nice, good. You were supportive. You were explaining things to me in a good way.
Mhm.
Um, you were friendly, to be honest. Okay, apart from the start.
Okay, doctor.
Okay, but yeah, yeah. Nothing was, not uh, good in terms of the management, in terms of counseling me.
Yeah. Yeah.
So for everyone here is here's what Dr. Noor did. Um, she covered the present history, she covered the past history, she covered the sexual history, psychosocial. She asked about mood, which is not relevant to the situation. Um, um, you didn't ask me about my ideas about cervical screening. It would be good, or how much do I know about cervical screening? This is counseling. Yeah. So how much do I know about cervical smear? What's my idea? Do you have any other concerns? Okay, and then you move on to counseling me. I did have three or four questions. Um, am I eligible, or why did I get the letter? And what is Pap smear? What are the risks of having cancer? And um, will it be comfortable or uncomfortable? Okay, and you answered me my questions correctly. You were having a very good listening. Okay. Okay, so good, Dr. Noor.
Yeah, I passed.
Yeah, yeah, you can pass the
Yeah.
dissertation. To be honest, you covered
Yeah.
most of the points.
Yeah.
You might have, a tick in the rapport,
Yeah.
lower interpersonal skills like two.
Mhm.
Okay, but you can pass the station. Yeah,
Thank you, doctor. Thank you for your time.
thank you. No worries, darling. All right.